Hi, my name is Dr. Kimberly Sanders, and I'm a clinical pharmacist, and I specialize in pharmacy practice and medication management in dental settings. Risk mitigation strategies for opioid prescribing stewardship are noted as ways to help reduce the risk of adverse outcomes of addiction, unintentional overdoses, and death that can result from inappropriate prescribing or misuse of opioids. There continues to be heightened concern across the United States and within North Carolina about the non-medical use of narcotics, including opioids, and the adverse consequences associated with their use. As members of the healthcare community, part of our task is to balance the need for pain management with the pledge to do no harm. You and the healthcare community can use risk mitigation strategies to help reduce the potential for negative effects from the non-medical use of opioids. In this video, I will give a high-level overview of those strategies, but there will be subsequent segments with a deeper dive into each strategy. Having practical steps and processes in workflow practice can help ensure each potential person who may receive an opioid prescription has been assessed and informed. Many of the key strategies that will be discussed are included in the 5 steps for responsible opioid prescribing and awareness per the first Do No Harm program by the National Academy of Medicine. These steps include 1. Tailor treatments for each patient. In many cases, particularly those for dental procedures, use of opioids may not even be warranted, and use of non-opioid analgesics are preferred first line. Also, keep the patient's clinical and social circumstances in mind, and have a full discussion with the patients about opioid concerns prior to prescribing. Emphasize that vigilance for dependence should be a routine part of the patient care process. Number 2, employ precautionary protocols. This can include utilizing prescription drug monitoring programs, also known as PDMPs, and drug screens. Number 3, actively manage and monitor. This means developing a mutually agreed upon therapeutic plan and dosing timetable with each patient prior to initiating opioids. In addition to monitoring the patient's response, assess for side effects, and be prepared to refer patients for follow-up care. And number 5, treat and link to treatment services. This includes screening patients at risk for misuse or abuse and utilizing a patient-centered approach to work with centers of expertise in the care of people with complex addictions and co-occurring substance use and mental health conditions. Co-prescribe naloxone to patients at risk of overdose, and provide information to the patient and family on when and how to use the reversal medication. The goal of risk mitigation is to make opioid prescribing safer while maintaining access to opioid analgesics for those patients who are benefiting from them. 4 risk mitigation strategies covered in detail include use of the prescription drug monitoring program, optimal patient communication practices and medication consideration for safe treatment, appropriate storage and disposal, and consideration for naloxone co-prescribing when appropriate. Thank you.